Hello, my name is Samantha Montalegre and welcome to the Maternity Mentor. Today we're going to be talking about breastfeeding after breast surgery. Thanks for joining us. For anyone who doesn't know me, I have been a registered nurse since 2009. I've spent my entire career working in the maternal newborn nursing area, including mother-baby postpartum, NICU, antepartum, and labor and delivery. I have practiced as an IBCLC since 2012 and have been maternal newborn nursing certified since 2013. I have also received specialized training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Many women have breast surgery for a variety of reasons, some of which is by choice and some of which is due to medical necessity. At the time these surgeries take place, women may or may not even be thinking about future breastfeeding. However, once a woman is pregnant, breastfeeding often becomes the first thing she thinks about. So the question becomes, can I breastfeed after breast surgery? The answer is usually. So let's learn more about why this is and how to make breastfeeding successful. This video will refer to women and breastfeeding throughout. However, we recognize that many transgender and non-binary individuals choose to breastfeed or chest feed their babies. The language in this video is not meant to exclude, but is simply used for ease of speaking. Breastfeeding uses a feedback loop between the brain and the breast to produce breast milk. It utilizes nerves and hormones. When the mother feels the suckling at the breast, it sends a signal to the brain to release hormones that assist in producing and releasing breast milk. Additionally, it triggers milk to be stored into ducts in the breasts. Any interruption or damage anywhere in this system can cause a disruption or problem with breastfeeding. However, our bodies are amazing. Even after significant surgery, for example, when removing the nipple entirely and then reattaching it, the body is often able to heal itself and reconnect the ducts to the nipples through a process called recanalization. Before any surgery, talk with your surgeon about future breastfeeding plans, whether you are not sure you want to breastfeed or whether you definitely want to breastfeed. The discussion is important because your surgeon can utilize surgical techniques to reduce damage to the breast and preserve milk-making tissue, milk ducts, and nerves. You also want to plan your surgery, if elective, for a few years before you want to breastfeed. There is evidence that breastfeeding is more successful when the surgery was performed 5 or more years prior to pregnancy. There are many types of surgeries a woman can have. The first is breast implants. Breast implants are used to increase the size of a woman's breast. They can either be saline or silicone and may be used for reconstruction purposes after a mastectomy or partial removal of a breast. The second type of surgery is a breast reduction. Breast reductions are the removal of tissue in extremely large breasts. Breast tissue and extra skin are removed during the procedure. Removal of breast tissue can affect the ability to make milk. Additionally, the nipple is often removed and repositioned. Moving the nipple can have a significant impact on breastfeeding due to cut ducts and nerve damage. Biopsies are surgical incisions to check for cancer or infection. During this procedure, a piece of tissue is removed for examination. Unfortunately, the location is usually determined by the condition and cannot be changed to improve breastfeeding. That being said, biopsies are a minor breast surgery with minimal impacts on breastfeeding. A needle biopsy is when a needle is inserted into the breast and withdraws the contents of a lump, cyst, or abscess. This procedure rarely has adverse effects on breastfeeding. A lumpectomy is the surgical removal of a lump in the breast. If the incision is made away from the areola, breastfeeding is usually unaffected. However, incisions near the nipple can have negative impacts. Additionally, if radiation is required, this can also have adverse effects on breastfeeding. A breast lift is the removal of excess skin around the breast. It is also called a mastectomy. It is a cosmetic procedure to tighten the breast. Sometimes the nipple is also moved to accommodate the new look. Depending on the incision and nipple work, there may or may not be significant impacts to breastfeeding. Finally, a woman may have a mastectomy. A mastectomy is the removal of one or both breasts, usually for the treatment or prevention of breast cancer. The breast tissue that is left may still be able to make milk, depending on how much tissue has been removed. However, if a woman needs radiation therapy afterwards, this usually damages the remaining breast tissue, making breastfeeding almost impossible on that side. If a mother only has one breast removed, the other breast should be able to make milk with no issues, and it can even produce enough milk to exclusively breastfeed without supplementation. Let's also talk about nipple piercings. Nipple piercings can affect breastfeeding. This is because they can cut off the outlet of ducts through the nipple. They can also cause scarring, both of which can lead to plugged ducts and mastitis. It's important to remove nipple jewelry during the second trimester and keep it off until breastfeeding is completed. If you choose to leave the jewelry in place, it must be removed prior to breastfeeding as it poses a choking risk. If the piercing is new, it may heal closed during this time. Additionally, pierced nipples may leak or squirt milk in different directions through the pierced holes. It's important to consider the impact surgery can have on breastfeeding. To start, it's crucial to understand the location of incisions because they can make a huge difference in breastfeeding and are involved in almost all the surgeries and procedures mentioned. If the cut is around or across the areola or nipples, nerves and ducts are more likely to be cut and the impacts can be more negative. Incisions under the breasts, near the armpits, or at the belly button are better, and you can usually produce breast milk because the milk ducts, glands, and nerves have been preserved. A big question to ask yourself is, can I feel sensation in my nipples? If you have decreased sensation or complete lack of sensation, production of breast milk and letdown may be affected. Nipple sensation may also return in a few years following surgery. The next consideration is specific to implants. The location of your implant has a significant effect on breastfeeding. Implants placed under glandular tissue or on top of the chest wall usually involve cutting and manipulating the ducts and nerves. This can have a greater negative impact on breastfeeding. Additionally, the implant can place pressure on the ducts, preventing them from filling to their greatest capacity or even blocking them, which can lead to mastitis and abscesses. On the other hand, implants placed behind the chest wall leave breast tissue and ducts intact, improve the odds greatly of successful breastfeeding. Additionally, if a silicone implant is used, silicone will not enter your breast milk. Finally, some surgeons will perform an augmentation behind the chest wall and yet still move the nipple for cosmetic purposes. Remember, moving the nipple can cause great damage and can have significant impacts on breastfeeding. So make sure you and your surgeon are clear on the plan prior to surgery. For many procedures, the answer to why it was performed is obvious. Lifts and reductions are generally cosmetic. Biopsies, lumpectomies, and mastectomies are generally for medical treatment. Breast augmentation is a different story. Most people assume breast augmentation is simply cosmetic. However, the story can be much more than this. If a woman had symmetrical small breasts and chooses to enlarge, breastfeeding has a greater chance of success. However, many women get an augmentation because their breasts were spaced far apart, their breasts were tubular in shape, their breasts never developed, or their breasts were asymmetrical in development. All of this can point to inadequate glandular tissue. This is called mammary hypoplasia, and it can affect the production of breast milk and breastfeeding, which is called primary lactation failure. If you are not sure whether this is the case for you, there is one important sign to look out for. Did your breasts change during the pregnancy? Breasts generally get larger and the areolas get darker. These changes are part of the process of lactation, but be aware some women experience little to no breast changes and are still able to breastfeed exclusively. Now that we have identified the types of surgery and how it can impact breastfeeding, it's time to figure out what to do. First, check your insurance to see what kind of lactation benefits you have, including coverage for a lactation consultant to help you after delivery, as well as coverage for a breast pump. If you are entitled to a breast pump, order it before delivery if possible. That way, it is ready at home for use. Whether you have coverage or not, determine whether there are lactation consultants to call on for assistance after your delivery, and keep their numbers close. Find local breastfeeding support groups, maybe even visit one before delivery to make sure it will work for you and get any questions answered that you may have. Finally, budget for a hospital-grade breast pump rental. Many mothers who have a breast surgery benefit from the use of a strong breast pump after delivery, especially if the baby is not feeding well for whatever reason. While babies are the best pump, hospital-grade breast pumps provide extra stimulation to help send the right signals to your body to start making milk. Here are some tips to help with breastfeeding success. Breastfeed your baby as soon as possible after delivery and continue to breastfeed frequently every 2 to 3 hours around the clock. Practice lots of skin to skin for the first week of life. Your baby's touch and the sounds your babies make help with the hormonal process of making milk. Practice hands-on breastfeeding. Before and after breastfeeding, massage and hand express your colostrum to help stimulate and increase your milk supply. You can spoon feed or finger feed your baby this colostrum. Practice hands-on pumping. Hands-on pumping is when you hand express colostrum before and after the use of an electric pump. This has been proven to increase milk supply faster. When using a pump to help bring in a milk supply, start with a hospital-grade pump until your milk production goals have been met. Hospital-grade pumps have stronger motors with a wider range of suction, which is important for producing breast milk. Make sure to contact the hospital's lactation consultant. You want them to evaluate the latch and feeding of your baby. Babies are the best pumps and best stimulators of breast milk production, but ensuring everything is going well can mitigate problems down the road. Keep track of your baby's pees and poops to ensure the baby is eating enough. If you have any concerns, please contact your pediatrician with questions. If your supply is a concern, talk with your healthcare provider about the use of herbs or medicines referred to as galactagogues, which can help increase your milk supply. Be sure not to take anything without talking to your provider first, because some of these are not good for your baby. Supplement as needed and don't feel guilty about it. Any amount of breast milk is better for your baby than none at all. However, there are times when supplementation is needed. You can supplement using formula or pasteurized human donor breast milk. If you continue to desire exclusive breastfeeding at the breast, ask a lactation consultant about a supplemental nursing system or SNS. This is a container of milk, breast or formula, that hangs around your neck and has a tube that's attached to it and connects to the nipples. When the baby suckles at the breast, they get breast milk directly from the breast, as well as milk from the container through the tube. This has an added bonus of continuing to stimulate the breast through suckling, which can work to increase the milk supply. Finally, for transgender or non-binary parents choosing to breastfeed or chest feed, make sure to contact a lactation consultant or support group that will support your choice both physically and emotionally. This can assist in a very rewarding and successful experience. Breastfeeding after breast surgery is likely to be a very positive and rewarding experience. Many women who have had surgery are able to exclusively breastfeed with very minimal issues. However, it is essential to have good support to ensure victory. We hope this video has taught you how surgery can affect breastfeeding and has given you some tips to make sure your breastfeeding journey is successful. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.